Good afternoon and welcome to this very special edition of Time to Talk with Jen Graziano, the second part of our series, Aging in the COVID Era. Today, our focus is going to be staying safe at home during COVID. For so many of our seniors, there's such a desire to age in place. It's part of a larger national movement. You hear it discussed so much. There's such a comfort in what is familiar, particularly our homes. Nowadays, though, in light of the COVID pandemic crisis, there's even more of a push to stay in place because of what we know is going on in our hospitals. The amount of COVID admissions, the increased number in ER visits. Hospitals are really never a place we want to go, but specifically now, we want to keep our loved ones home where we can be granted access to them perhaps, or at least letting them stay with trusted aides in a familiar setting. So I have three experts that join me today who are very, very versed in home care, and again, trusted authorities. We meet weekly as part of a larger senior provider network, so I'll vouch for all of them and introduce them to you. So I'm joined by Denise Kubier, the Senior Vice President of Care for Lean On We, a trusted way to hire a caregiver in your home. Lou Giampa, the President and owner of Right at Home, a New York State licensed home care agency. The word licensed is so important. And Joanne Parliament, the Director of Patient Services for Visiting Nurse Services Westchester, located in White Plains. I welcome you all.
Thank you, Jen.
And it's been a pleasure getting to know some of you. Lou, I know you a bit longer just through all of the similar circles that we travel in. But again, we're going to give our listeners today a clear understanding of home care options, what they should be aware of, and the do's and don'ts right now, because the landscape has changed for sure. The dialogue has changed. The questions have changed. But Denise, I'm going to start with you. What are the challenges for home care during the COVID crisis?
So, Jen, thank you for having me on. And I'd like to first start by saying, I think now more than ever, home care agencies are working together to provide services to clients. So if there's something that Lean On We cannot help with, we are directing them to somebody who can, and really trying to work together to serve the community. I would say in the beginning of the pandemic in early March, as everybody had an unknown of what was happening in the world, so did home care. And the unknown went from nursing homes to hospitals to home care agencies. And we had a really difficult time gathering information about what's happening with the client. When were they tested? When were they tested? How long are they infectious for? And then being able to purely share that information with the caregivers. If we're sending caregivers out in their home, we needed accurate information. Unfortunately, we also found that there was families that were not giving us accurate information. So we were going through a period initially where they would say something's wrong, but I don't know what it is. And we were trying to gather information. Is this COVID? Are they contagious? Have you seen a doctor? Did you get tested? So in the beginning, the challenge was really about gathering the accurate information from all the providers that were asking us to put caregivers in the home.
So your contact, there's so much I want to cover here. Your contacts, and anybody can jump in for this question, are primarily more with healthcare facilities, staffing them with the licensed aides or the proper aides and nurses, or it's direct with families. Where do you usually lie in your conversations?
I'll just say for Lean On We, we're usually providing caregivers to families at home that need services at home. Occasionally we'll provide services in an assisted living or a nursing home, but primarily Lean On We services the tri-state area in people's homes.
Okay. Thank you very much for that. So again, all changes that, we speak with our colleagues in the nursing home realms when we do our weekly calls. We speak with attorneys who specialize in elder law, but there's been a change no matter where you fall on this front. There's been a change in what you experience day to day. So Joanne, I'm going to go to you. How do you do with clients being so fearful of having professionals come in due to fear of COVID?
Rockland and part of the Bronx. We service patients that usually come from skilled nursing facilities or hospitals, but we also service patients direct referrals from their doctor's office as well. I think the challenge that we had of people being fearful to have healthcare professionals come in their home because they were concerned that they were going to be exposed to the virus by having the professional enter their home. We had to reassure them of the benefits of having someone in the home versus not, to prevent them from going into the hospital, because that was our main goal. If the physician or they were being discharged from a hospital in a state that was not so well that they could manage independently, we wanted to assure them that our services would keep them from going back to the hospital, and that our staff were all wearing masks when they visited them. Our infection control protocols were geared up for our staff to be prepared to service the COVID patients and to protect themselves and future patients that they were seeing that were non-COVID. So we really had to reassure the patients in the community that they were not going to be directly exposed to the virus by having a frontline worker coming to their home. Many patients did refuse, and I know Lou and Denise probably experienced the same situation in the beginning, or even people that had us in their homes at the time of the outbreak canceled services and discharged themselves. So that was a real challenge for all of us in the beginning when we started seeing patients.
It makes so much sense. I mean, you see people with fear to have their own family members come. You know, people don't have their children visit. You know, I actually directed a funeral today for a family, and we were all still separated, although we were all family. So it does make a lot of sense. And those are valid questions. How do you protect your safety coming into your home when these are arguable strangers? But I think, you know, you've given very good assurances to our listeners. And I think, you know, going forward, we're also going to give tips for people who are looking to enlist these type of services in the home, of what are the questions that they need to be asking to ensure the utmost safety and security of their loved one. But Lou, I'm going to turn it to you. What do you actually do, though, to keep the clients and caregivers safe? Because you're balancing dual interests. You need your caregivers healthy and minimally exposed if possible. And then again, you want your clients themselves to be at low risk. So what are you doing to make that happen?
Okay, so I think it really begins with two things. Number one, for the clients and their families, it's communication and it's education. So right off the bat, we're in constant contact with the families, the clients themselves, a lot of times the adult children. We've been giving them phone calls, regular emails, newsletters about what's going on. We're giving them up-to-date CDC guidelines, some tips and strategies for visiting their parents when we're not there, some protocols they should be following. Like you're saying, a lot of people feel very strongly about what's going on here on both sides of the spectrum, and we have to do a lot of hand-holding to make sure everybody feels okay. So we actually have to worry about both clients and caregivers. So when we first start cases, we actually have to screen the clients themselves first about their COVID exposure, you know, their secondary and tertiary exposures, because again, it changes the dynamic if they've been exposed, what types of caregivers we have to put in the home, their training, the PPE equipment being used. And from the caregiver's perspective, it goes the same way. To make sure the clients feel at ease, our caregivers are checked regularly. We have to screen the caregivers daily. We do temperature checks, we do symptom checks. You know, we're constant communication with the caregivers. Have they had any secondhand exposure, third-hand exposure? Have the people they live with been exposed to this virus? And if they have been, you know, we're quarantining them for 14 days out of abundance of caution. You know, we work with a very vulnerable population, so it's really our responsibility to take extra precautions to make sure people are okay. A lot of clients, we've offered some different opportunities when they're nervous. We've changed a lot of hourly care to live-in care, because sometimes they're just more comfortable with one caregiver staying inside their house for periods of time. We have some clients where we're setting up car services for the caregivers to get back and forth because they don't want them traveling on public transportation. We also have some protocols in place where my caregivers that are working in skilled nursing facilities and assisted livings, they usually tend to work with multiple clients and they have a little bit of increased risk of exposure. We're not allowing those same caregivers to go into people's homes. So we're kind of segregating who goes where, limiting the contact to basically decrease the risks. A lot of it too is the PPE equipment. We're furnishing the caregivers with all the proper equipment when they're working their shifts. And we're also furnishing them with equipment for them to travel to and from their homes. So we're giving them extra to make sure that they're protected in their travels. We're limiting the amount of caregivers for each client. That's been helped quite a deal. And I think it's about a few things. You know, we're trying to source as much PPE equipment as possible to be for the sake of both the caregivers and the clients. We've done a great job of that. My Right at Home corporate office has given us a lot of equipment that's helped during this time as equipment is harder to come by. My RN spends most of her days traveling, and she is either dropping off equipment most of the time or checking out caregivers and their symptoms. So there's a lot of different layers that it takes to make people feel at ease. And I think the most important thing is really back to the communication issue. So if there's any changes in condition for both caregiver or clients, that's communicated to us in real time so we can act on that and basically make the appropriate recommendations if someone needs additional cares or if someone needs medical attention.
So it's definitely a lot being done, though. You know, it seems like a lot of checks in place, a lot of protocols. Definitely seems to be going above and beyond. Again, so many casualties of the COVID crisis, so many resources are no longer available or temporarily put on hold. But outpatient rehab facilities are closed. Now, the alternative to that is that, elective surgeries have been stopped, and I think this week there's some discrepancy on that, but I think they're just starting. So I don't know if this seems to mitigate the need for outpatient rehab. But that being said, there are Medicare benefits that people are entitled to that they're not being able to use. Joanne, how are clients able to maximize their Medicare benefits at home should they have any of these outpatient rehab needs?
So as a certified home health agency, we're able to bill Medicare and Medicaid and third-party payers for the skilled services that clients are getting in their home. Skilled services meaning nursing, physical therapy, occupational therapy, speech therapy, and then they're able to get ancillary services like short-term home health aid and short hours for personal care or social work if they need to assist them. During this pandemic, Medicare has waived some of the regulations that were currently in place to allow us to service some of the clients that we weren't able to service in the past, such as the requirement of being homebound to require services. For the population, as Lou said, they're very vulnerable to be exposed in the community. So if their physician advises them to stay at home and avoid contact with the outside world, which we're now, but even to go to the physician's office or to an outpatient rehab if they were open, they would be considered homebound under the Medicare regulations, even though they could get out of their home without assistance. So that has really helped some of those patients that were going to outpatient rehab or going to their physician's office to get treatments for us to come into their home and treat them. So when the outpatient rehab was closed and their symptoms were becoming worse, say for arthritis, and they were having symptoms of increased pain because they weren't going to their outpatient rehab, we were able to take those patients onto service and do the rehab services at home, similar to what they were getting at an outpatient setting. If someone was receiving treatments at a wound clinic, we were able to provide that service at home for them so that they didn't have to go out and expose themselves. So that was really helpful for those clients. The other regulation that was waived was that, oh my goodness, I lost my train of thought. So if they were getting services at home, then we could bring them in. many of the clients were concerned about this. And the other service that was waived was that they would need to have a face-to-face encounter with their doctor in order to get services for the home care. What was waived is that they could have a face-to-face encounter with a physician over the telephone, a FaceTime conversation with the doctor to say, I'm having exacerbations of symptoms. Maybe their blood pressure was going out of whack, they didn't feel well, maybe someone with cardiac issues was having increased shortness of breath. We wanted to keep those people out of the hospital. So the doctor might have called us and said he did a FaceTime with them over the phone, and we were able to service them in the community. So those two regulations being lifted really helped the Medicare population to get the services that they needed, because again, we don't want these people going to the hospital where they would be exposed in the inpatient setting.
Absolutely. So in terms of caregiver availability, Lou, do you find that you actually have caregivers available to work with these clients during this time? Do you see, an unwillingness of the caregivers to go out onto the front line? Or are you short-staffed?
So we do have caregivers that are working with COVID positive patients. I think the screening is what's most important. Kind of like what Denise alluded to earlier, we really need the families to be open and honest with us about the condition of their relatives when we're starting care. If we know they're COVID positive, there's certain steps we have to take. It's a different level of PPE equipment, personal protective equipment. It's not just masks and gloves. Now we're talking about N95 respirators, gowns, visors. My nurse has to do fit tests. There's some specialized training to make sure we're minimizing infection. So a lot of it goes into taking care of COVID positive patients. I think the hardest part, like you just mentioned, is having aides that are willing to do it. We do have some, but again, we do have our fair share of aides that don't want to work with COVID positive patients because they might have young children at home or an elderly relative at home and they want to minimize their exposure. But we do have a team of people that are ready and willing to go. So as long as we know when we do a proper assessment and their aides are trained properly, we know how to take care of people with minimizing the infection. The key part is the willingness of the workforce to do that.
Over the years, I'm sure all of you collectively have seen an increase in the push to age in place and to stay at home, regardless of COVID. Can you each identify, Denise, maybe you can answer that. Do you see an exponential growth of that now? Are the numbers that much higher of people who want to stay in the comfort of their home?
I think
Sorry, Lou. I think that it's interesting. We see an increase in people staying home, but under the pandemic, families are taking care of them. So I wouldn't necessarily say there's a lot more people that are staying home that need care. I would say there's a lot more people that are staying home that have family caring for them. I imagine when this pandemic slows down and family members have to return to work, we're going to have an influx of people looking for caregivers.
That's an excellent point. People have an abundance of time and some who are able to work from home. That's an excellent point. They're able to provide care. But then on the flip side of that, it's not often the same care. And although family members are well-intentioned, they're often ill-equipped to handle the work of caring for somebody with enhanced needs. So you could see both sides of that coin. So Joanne, whenever you have a hospital discharge, it's always the goal to minimize the chances of readmission. Again, particularly now more than ever. So can you do some type of review of care for COVID patients and families when they are discharged from a hospital or nursing home?
So when a patient is discharged from a hospital or a nursing home, or even if they're home and they test positive and the physician wants us to go in and make sure they're doing okay, some of the changes that we've made to protect both the patient and our staff and their families is our staff wear full PPE when they go into the home. They put it on before they go into the home. They wear a face mask, an N95 mask, a head covering, an isolation gown, and foot covering and gloves. We're providing blood pressure cuffs, stethoscopes, thermometers if they don't have them, masks for the family members and the patient, and hand sanitizer if they don't have it, for them to have at home. For the clients that were concerned about the oxygen level in their system, because as we know, the virus affects the lungs severely, and many of the clients have low oxygen levels, we immediately put a telehealth unit into their home, usually the day that they're discharged from the facility or the morning that the clinician is going to go into the home. The telehealth monitors their pulse oximeter, which is their oxygen level in their blood pressure, their pulse, and gives them the opportunity to have video visits with someone in the office. The other thing that we've done to decrease exposure to both the patient and ourselves is we integrate video visits into their plan of care for the first 2 weeks of service. So the clinician may be calling them twice a week and doing a video visit if they're on the telehealth, or doing a FaceTime visit if she can, to make sure that they're doing okay. When they're on the telehealth, they should be monitoring their vital signs every day. And even if they aren't on the telehealth, we encourage them to utilize the equipment that we've left in the home to make sure that we could see if there's any trending that would impact them negatively, to again prevent them from going back into the hospital. We found that that's been very successful. The majority of our COVID positive patients that we've treated, and we've treated over 150 since the beginning of April, have all been discharged at this time with most of them goals met. I think at this point, we've only had 2 patients that have gone back into the hospital, and those were usually patients that had multiple comorbidities that were impacted by the virus, and that was the reason for them going back into the hospital. So I think the plan of care program that we've set up for them has been positive. Also, the big focus of our care is to educate the caregivers and the family members on how to prevent the spread of the virus, how to clean the environment that they're in, and to teach them, proper infection control as well, how to wash your hands properly, how to do your laundry, how to clean surfaces and things like that, to prevent other people in the household from getting infected, as well as decreasing the spread to the caregivers in the home as well.
There's such an education in this, to all parties involved. Things that, we took for granted, maybe the importance of sanitization and hand washing, things that were so basic have kind of been brought to surface. But again, it's important to educate family members to help arm seniors in this fight against COVID. Denise, what are some of the more specific challenges at this time for families? Families who are maybe looking for guarantees that caregivers are COVID negative, but we all know, you can get swabbed today and test negative, and then in fact catch it the next day. I mean, and then it incubates for a while. So what are some of the challenges for those fears that they have? And also, what do you do when I don't even know if you want to go into the antibody testing, which, tends to really produce a skewed result sometimes. But how do you recommend that families handle these concerns?
Then it's so difficult these days. There's no guarantees. And sometimes family are looking for guarantees. And it's very hard to tell someone, we can't guarantee you. We could test the caregiver today. They could leave your office, and the moment after the test is done, there's no guarantees that they're not going to come in contact with somebody that is infected, and they get the virus themselves. They could be asymptomatic and a carrier, but it's very difficult to speak to everybody about the disease itself and what to do. We talked about it yesterday on our expert call. Some assisted livings are testing one way. Some nursing homes are testing another way. It doesn't matter really what you do. There are no guarantees. And that is the hardest thing to tell someone when they're trying to hire services to protect, to get services for a loved one. As much as they want everything done, it's so hard to tell them that I can help them, but I'm not going to provide a guarantee. And in terms of the antibody testing, you could have an antibody test, and there's evidence out there to show that the antibody testing, some of them are inaccurate. You could have, there's many different types. So there's a finger stick antibody, there's a blood antibody test, but you could have the antibody test and still have a COVID positive nasal swab. So what does that mean? And I'm always inquiring for myself, what does that mean? Are you still shedding the virus? Are you not shedding? Are you infectious? And so I think the unknown makes people very fearful, including us, including healthcare providers, including people that are sending caregivers out to the home. We don't have the answers either, and it's hard to say that to somebody, to a family member.
Understood. Again, we're all looking for a guarantee that we can't get, and I think that's all of us. We all want to know, when will this be over? When will life return to normal? It's hard to answer that. There is no answer to that, but we're all looking for that comfort. So moving forward, we know so much has been spoken recently about the governor's mandate, and with nursing homes, I can really spend a whole show on that, but I won't. Has any of that impacted your realm? Again, we talked about putting the aides in homes, but now with the mandate that if people are in a nursing home and do test positive, is it my understanding that they have to be removed from the home and brought into a hospital, that they cannot continue their COVID care in the nursing facility? Can you correct me on that, or?
I think a lot of the have isolation wings in different places that they keep certain COVID positive patients. And I think that the more testing that's available, the quicker they're able to diagnose these things, they can keep them away from their general population, who tend to be very vulnerable. And I think, we've gotten a lot of phone calls of people that have come from hospitals into the skilled nursing facilities and they're looking for us to send our aides in there to keep these people company and basically be able to give the families a lot of feedback, because the families themselves are not able to visit. But it's my understanding that the nursing homes are really trying to isolate the people that have the symptoms and been tested positive and keep them away from their general population to protect them.
But they have to have the adequate facilities to do so. Correct?
Yes, and that's I think one of the biggest challenges they're facing.
Yep. Yeah. Okay. So do you find is there an increased demand for staffing in nursing home facilities?
Well, especially, I will speak from experience a couple months ago when more and more of the staff themselves were getting sick and getting exposed before people had proper equipment and proper protocols. We got a lot of requests for assistance, from assisted livings, from skilled nursing facilities that were short-staffed. And again, we talked about, the abundance of caution having to quarantine caregivers who come in contact. And quarantining someone for 14 days leads to staffing shortages everywhere. And, we're all experiencing that in home care as well at times, because we have to do what's best for the patient. So when those things came about, a lot of our referral partners have reached out to us to help with those, short-term, temporarily, to help fix their staffing issues.
Understood. Are there any guidelines that have come from the governor that specifically address home care requirements? I know nursing home workers must be tested biweekly. Are there the same stringent requirements for anybody caregiving in the home, or a different set of requirements perhaps?
I think for us, we're required for our staff to self-report their temperature twice a day. And if they have a temperature above 100.4, they need to be removed from the field until they're fever-free without fever-reducing medication for 72 hours. They should be self-reporting any negative symptoms that may be consistent with COVID, and we know that there's a variety of those. So those are some of the requirements that we have in place. I'm not sure. I think the licensed agencies have similar requirements as well.
Yeah, it's the same for us. We are mandated by the DOH to check symptoms and temperatures twice a day, which is what we're doing right now.
Do you believe, again, in the absence of a crystal ball, that when all of this is over, though, there'll be more of a move towards the home care model versus facility care?
I
Absolutely.
believe so, but it depends how short people's memories are.
I think this is going to be with us for a very long
I
time.
agree.
I think people are frightened to go to the hospital, and we have to remind them that sometimes this is the place where they need to be. But we have to just keep on educating them that I do believe home care is the best venue for people that are not sick enough to go to the hospital. And I think there may be a positive thing from this, that home is the best place to be if you can manage at home. So I think we really have to push that to people to let them know. Unfortunately, if you don't have the financial ability to hire privately, that could be an issue, but I'm sure maybe one of your shows will educate the population about how to access Medicaid benefits and things like that in the community, which people may not be aware of. So I really believe home is the best place to be because you're with your family, and
What better
we
place?
can manage you at home. If you can manage at home, that's definitely, we can all three agree on that it's the best place to be.
Well, I concur with that as well for many reasons. I mean, there's just so many benefits of being home. Um, any final thoughts or any final tips? You've given so much information on, the proactive steps you're taking with your respective agencies. You've helped us understand the fears and concerns. You've brought them to surface that many of your families are facing. But any final tips that each of you would like to give our viewers today and going forward for help with staying safe at home during COVID?
You
Oh,
want to
I
start?
think that most important thing we talked about a lot of here is a lot of education you've gotten from everybody and communication, and I think that everyone's got their own feelings and what's going to make them feel safe. So I think the most important thing is to reach out to your professionals, have a preliminary conference call, talk to them about your concerns, and be very open and transparent. This is what I'm concerned about, how you're going to address issues A, B, C, and D. And all the professionals are willing to help you. They'll tell you everything that we can do. Hopefully, they'll be able to give you a little bit of peace of mind to allay some of your fears about how we're containing this virus and working within this virus. And the more educated you become, the more information you have, your comfortability level is going to increase. And then again, a lot of people really need care and sometimes are a little afraid to get it because of what's going on. And the more comfortable you feel and the more education you have, the more you're going to get that care that you need, and you're going to have a more healthy outcomes. And that's what we really encourage, the communication.
Wonderful. Denise?
I would say that in line with what Lou's saying, there's a lot of experts out there. And honestly, if you called me and I couldn't help you and I wasn't the right resource for you, and I thought somebody was better suited to take care of your loved one, I would refer you to somebody that I know is trusted and has the ability to do what you want to do. So I would say, as a home care industry, we actually do work together, even though we all do different things. And there is somebody out there that can help you. You just have to, do a little legwork if the first place you call isn't the right place.
Yeah, you always have to have a backup plan. And finally, Joanne?
I think I kind of agree with what Lou and Denise are saying in terms of call. We can try our best to work anything out with you that you would think is literally impossible to do at home, but we could work it out. We could come up with a plan. We can come up with solutions. And if we don't, we work very well as an industry together. We sit on committees together. We know what the other people do. We would, in a heartbeat, refer you to someone else who we think would do a better job with you than we do. Right now, there are so many things that are coming out for the seniors on how to learn how to navigate electronic devices. And there are even organizations that are giving electronic devices to the senior population to help them communicate with their doctors. virtual visits to museums and movie theaters and shows and things like that. So I think this is the opportunity for the senior population to take in all that's available for them and try and get as much in as they can now so that they can utilize that for the future to help themselves. And that's the takeaway that I'm giving the population for the senior community right now is take it all in now, because these are all the resources that you could use for the future.
Wonderful. So I thank you all for your time today. Again, this was the second in our 4-part series of aging in the COVID era. And today our focus was on staying safe at home. And you've certainly provided listeners today with tips that'll help effectuate a peace of mind for sure. I thank you all. I look forward to speaking with you on our next meeting on Tuesday. And with that, this is Jen Graziano thanking you for taking the time to listen as we took the time to talk. Stay safe, everyone. Have a great day. Bye-bye.